here would like to address the board, 3 minutes per speaker. Okay, with that, we will move ahead to our agenda items. I'm looking for a motion to approve the proposed fee schedule for the Shiawassee Animal Control Center.
So moved.
Or,
Discussion?
so very briefly, we have been working off of a temporary schedule of fees that we were adjusting and honing based on other counties around us. And the sheriff has proposed the following fees for adoption, rabies vaccination, pet care, pet vet transportations, different things like that, and boarding fees related to it, so that we can assess them and they have to be approved by the board. We have been doing some in the interim because we've had a few animals out there.
Okay. All right.
I mean, I think it looks reasonable. Adoption fee of $20, fair enough.
Yeah.
I like that we're gonna charge for boarding and care.
And some of this is gonna go to cases that end up in court. And so that if there's some recovery fees that we can get through, say, abuse related cases, then we know how much to recharge related to it. So there's a set fee.
Excellent.
Well, that's fair. I mean, you board a dog, you go on vacation. That's not free.
No, there's a cost to it. So. Any other comments? All right. All those in favor, please say aye.
Aye.
All those opposed? Motion passes. Looking for a motion for the approval of the purchase of VMware software not to exceed $25,423.20 and to approve the use of the fund balance.
I'll make that motion.
Okay. That's good.
So just as a note, this is a two-part thing, and I will let them explain what the software is, but it is needed to run the computers as a server so they can all talk to one another. But it was not a budgeted expense, so it has to come out of their fund balance. Instead of doing two motions, we just put it as one if you approve it.
Well, technically how it works is instead of having 11 different physical servers, we have 3 different virtual servers, which allow us to run multiple servers on each one of those. So the VMware is the software that controls all that, allowing your network to be virtualized. So in essence, even though the expense is quite high, it is saving the county a significant amount of money to go with that. Again, the company that is the VMware solution has raised their prices significantly in the last year. I can't give exact reasoning why that is, but we still recommend going with this solution.
Do you know offhand how much money the county saved by using the software? You said there was.
I mean, if I was to estimate a server between 8,000 and 10,000 a piece, so okay. It's a significant amount to virtualize.
And you would need a lot of them.
Oh yeah. Okay. So 8 times 11, 8 to 10 times 11. Okay.
How much did the cost go up?
I think it's you know what we paid last year? I think it's about 4 times basically is what we're seeing across the board. They were bought out about 2 years ago by a company called Broadcom. So last year they doubled the price, and this year they're quadrupling it. A little behind the scenes is my understanding is they don't necessarily want to support the smaller companies anymore. They're looking for bigger companies, and so they're charging us, and with the charge, they're also increasing the level of what they're providing, but it's not necessary for our network.
I think this will buy us time, so this next year, because this is a 1-year maintenance agreement, so this will buy us time to do some research and find an alternate solution. And hopefully be cheaper in the long run, but our hands are kind of tied in order to maintain and run how we are the next year, kind of are forced to do it.
And also, I don't know if everyone knows Todd Mead, he replaced Jackie from the RSD when she retired last year.
Oh.
In case you haven't met her before, or met her before.
Yeah, I miss Jackie.
Yeah.
Sorry, Todd.
If there isn't an alternate solution, then we'd probably be looking at this as a yearly expense.
Unfortunately,
I don't see the rates going up excessively again. I mean, honestly, I can't imagine they would keep going up at this rate. However, I can't guarantee anything, but we do have some alternatives that we're looking into.
I'm sure you also don't see them going down.
No, definitely not going down.
All right.
Any further comments?
Mhm.
Okay, can we, all those in favor, please say aye.
Aye.
All those opposed? Motion passes. Last call to the public. Anyone here that wants to say anything? All right, with that, the Public Safety and Courts Committee meeting is adjourned.
Call this meeting to order and let's stand for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Before we go into our first agenda item, I want to do a quick update. Larry, could you talk about New Directions?
Sure.
I did get a bit of an update at our CMH board, Shiawassee Health and Wellness, and I've heard great things, so I just want to kind of give this committee a little update on that.
So, this is a partnership, if you will recall, with Shiawassee Health and Wellness. And one of their branches is this New Directions facility in the city of Wausau, which is helping people that have diagnosed mental health challenges. And some of them have drug addictive behaviors and other things that have happened. It's a high-risk population, and some of you have toured the facility. And we started this partnership using funding that was provided by the Board of Commissioners from the opioid funds. And our nurse now has been out there. She is scheduled to be out there 8 hours per week. She goes on the busier days where they're serving food, which are Tuesdays and Thursdays. And she has already been making great inroads with this population. It started out as getting to know them, being comfortable around her, because if you know this population, it's a little bit of a challenge for them to accept new people. And so she's building relationships and comfort with them. And she is acting as a touch point navigator for some of these people to get them the services, not just at the health department, but other agencies in the county, whether it's food needs, whether it's getting immunizations from the health department, whether it's providing condoms, you name it. And so she's done multiple education sessions with them already. And I shared a flyer with Commissioner Garber, which I'd be happy to share with all of you about some of the things that we're doing out there. So we're very excited about that, and fortunate, and hopefully we can continue that with that partnership.
Yeah, thank you. And I'm excited about it too. You know, I'm very passionate about the work we do at Shiawassee Health and Wellness. And I was at a meeting not too long ago, and Kimber from Recovery Pathways, our neighbor next door, she said, you know, there's really no distinction between substance abuse disorder and mental illness. It just goes hand in hand. So I think we're getting a lot of bang for our buck with this opioid funding to have this professional there. Yep, Gary.
Do you have any count roughly how many people
Yeah.
join it? I mean,
Yeah, so on Tuesdays and Thursdays when they have the lunch is their bigger days. And they'll have anywhere from 25 on up
holy
to
gee.
maybe up to 50
Oh,
at a time, depending on you know weather and different things. So yeah, it's variable, but we pick the higher turnout days, which is when they provide the free lunches.
well, that sounds good.
Yeah, so it's pretty nice.
Yeah, it does. So, thank you for that. Didn't mean to put you on the spot, but
That's all right.
I kinda did, so.
It's fine, I'll stay right.
Yep. All right, so
It's
our,
all about you, Larry.
did anyone have any questions, I guess, before we go into our first agenda item? All right, so I would look for a motion to approve the contract between the Shiawassee County Health Department and ALZY Environmental Service LLC for registered sanitarian services in the amount of $41 per hour for an average of 24 hours per week for a period of January 1st, 2026 to December 31st, 2026.
I'll make the motion.
Support.
Moved and supported.
I would just say there's no change in the contract. This is a renewal that you do almost every year.
It's our contract sanitarian. He does wells and septics, restaurants, campgrounds, swimming pools. He's a part-time guy. He's been with us 5 or 6 years as a contract employee. He's registered, so it's a lot of good institutional knowledge. We kept the contract rate at the same as last year.
Which is a significant savings from having a full-time employee, so. All right, any questions on that? Nope. All right, all those in favor signify by saying aye. Aye. All those opposed, the same. I would look for a motion to approve the contract between the Shiawassee County Health Department and Dr. Dennis Chernin for medical director services in the amount of $41,250 for the period of 1/1/2026 through 12/31/2026.
I'll make the motion.
I'll support that. Moved and supported.
This is Dr. Chern's contract renewal. 2026 will be year number 40 for Dr. Chern at the Shiawassee County Health Department. So that's a feat. And we're keeping the rate the same as last year. The contractual individuals have been very receptive to our budgetary situation in the health department, and so that's a good deal for the county. Because when we change this, I say it every year. I've said it for 5 years now. It's going to be expensive.
You have, yep.
So we're going to try to keep him going as long as we can.
When he started, Ronald Reagan was president.
Yes, he was.
Is he thinking about retiring or don't you know that?
He hasn't said anything about it.
Okay.
He has retired from private practice,
Hmm.
so he has more time to devote towards his health department
Mhm.
positions. He also serves Lenawee and Jackson counties.
Hmm.
So
And he's just a neat guy. The times I've met him, really, really cool.
a lot of institutional knowledge.
Yes. All right. Any further questions on our 40th year with Dr. Chernin? All those in favor signify by saying aye. Aye. All those opposed, the same. We'll see that again tomorrow. For our last agenda item, this contract needs to be February 1st, correct?
It doesn't really matter. He can start it whenever, he can't extend it beyond. So you can change it to February because that's when she will start,
Right.
Okay.
but it's inconsequential in the long run. He can shorten the contract.
Okay.
It's a 60-day separation for MERS.
All right. I would look for a motion to approve the contract between the Shiawassee County Health Department and Deborah Bebo for billing services in the amount of $30 per hour for an average of 30 hours per week for a period of February 1st, 2026 to December 31st, 2026.
I'll make the motion.
Support.
Moved and supported, kind of the same setup as,
Yep, this is our other contracts. Recently retired. We want to bring her back part-time to continue the billing services. And doing so saves the health department substantial amount of money by not backfilling that as a full-time position. And we're gonna work through our budgetary situation this year, see how that goes. And if possible, to return it to full-time, we will. If not, we will continue with the contractual situation. Hopefully we can get things turned around as far as the funding so that we can get back to normal, but right now we need every penny saved in every possible way. So.
we appreciate your efforts.
Thanks.
Any questions Larry on that? All right, all those in favor signify by saying aye. Aye. All those opposed, the same. See that again tomorrow. Anything else for the committee? We're adjourned. Thank you.